So we described to you the Smith-Peterson approach, the anterolateral approach to the hip. The position of the patient is supine. Patient is under spinal or general anesthesia. Here is the anterosuperior iliac spine. Here is the anterior superior iliac spine, from which is arising the sartorius muscle. From the iliac tuberosity is arising the tensor fascia lata, this one. And from the outer surface of the ilium is the gluteus medius, which is going to go and attach to the trochanter. Now, after part preparation and draping, we give an incision between the sartorius and tensor fascia lata from the anterior superior spine, extending on the anterolateral surface of the thigh. We divide the skin subcutaneous tissue and we encounter an artery at this place, which is the circumflex iliac. We ligate it. Then we divide the deep fascia from below upwards, because it's easier to find the space between sartorius and tensor fascia lata below as compared to upwards. We removed the sartorius. We saved the lateral cutaneous nerve of thigh, which has pierced the sartorius 3/4 of an inch below the anterior superior spine, and we divide the sartorius from the anterior superior spine and reflect it downwards, saving the lateral cutaneous nerve of thigh. Then we divide the deep fascia parallel to the inguinal ligament up to the saphenous ring. Now, after removing this sartorius, we'll see the straight head of the rectus femoris, which arises from the anterior inferior spine and the superior surface of the acetabulum. Under it runs the lateral circumflex femoral artery. So, saving that artery right from the anterior inferior spine, will remove the straight head of rectus femoris. Now we'll reflect the iliopsoas. We'll detach the iliopsoas from the lesser tuberosity. It's attached to the lesser tuberosity here, like this. We will detach the iliopsoas from the lateral tuberosity and reflect it upwards. So we'll remove this iliopsoas. We'll show you how. We remove the iliacus and we remove the psoas. Now you see the pectineal eminence. We will reflect the pectineal eminence, and this is the obturator externus passing under the neck and getting attached to the trochanteric fossa. This is the obturator externus. So we remove the pectineus. We never go medial to the pectineus eminence because we want to save the nerve. And we start our incision from the pectineal, from the margin of the acetabulum, divide the labrum, divide the capsule, go on the anterior surface of the neck right up to the intertrochanteric line. Right up to the intertrochanteric line. So, margin, labrum, capsule, iliofemoral ligament, right up to the intertrochanteric line. And then we extend this incision like this along the margin so as to open these two flaps of capsule and visualize the head and neck of femur.